This is data from Canada. I showed this to you last week, and now this is updated 1 week later. And each week as I show you this data, we're going to get better, more clear outcomes as we have more cases. And we can see again that across Canada, 84% of people are having mild asymptomatic disease. 11% have been needed to be hospitalized. 3% of them have been in ICU, and 2% have died. If we look at that from an age-specific perspective, and again, remember, this is Canadian data, we see that if you're under the age of 20, you do very well, very few hospitalizations, and no child has passed away in Canada. Similarly, if you're between the ages of 20 and 59, the numbers are also very good as well. Only 6% have been hospitalized, and less than 1% have died. And again, these numbers are actually much better than what we see in other parts of the world. And really, the group that is at highest risk are those who are elderly over the age of 60. We see 20% have been hospitalized, 6% have needed to be in the ICU, and the death rate's roughly 6%. Again, these numbers are better than other regions in the world, but they still are sobering numbers. So we've actually been able to share modeling data. We've seen this in a number of different provinces, including the Premier of Alberta, who have provided modeling data to citizens of Alberta as well. And I just want to share some of those numbers with everyone. So again, in the context of not doing any physical distancing at all, we would have let everyone kind of continue on as society was before the pandemic. We all recognize that we would have overwhelmed our healthcare system. We would have gone into shortages of protective equipment for healthcare workers. Healthcare workers would have got sick, would have been redeployed. And again, these things are happening now, but they would have been happening so much worse if we hadn't have instituted these cases. And before the pandemic, we had about 8,500 acute care hospital beds to care for people. Since then, we've been able to prepare and increase that capacity. And the reason why that's so important is that if you look at the modeling data, the data that would have suggested if we did nothing, if we did none of the physical distancing, the school closures, keeping you at home, we would have expected a peak in cases in mid-April, essentially a week from now. And the overarching case, this pandemic would have lasted a shorter period of time, but over the course of that time, the projections would have been 1.6 million Albertans who would have been infected, and between 16,000 and 32,000 would have died. Those are huge, huge numbers. But what are we actually seeing? These numbers are actually much, much better in Alberta, as well as in provinces all across the country. With the physical distancing that we've instituted across the country, we now actually see that the peak is going to be pushed out to mid-May. And again, that means that we're in our homes longer, but it means that we're seeing less bad outcomes, less people being sick. We think now, based on our most probable projections, that only 800,000 people will be infected during this first wave of the pandemic, and that only 400 to 3,100 will die. Again, those are big numbers in context of death, but drastically smaller than if we didn't institute those measures for physical distancing. And again, this is for those who haven't had a chance to read this article, this is a fantastic way to visualize this. If we would have done nothing, if schools would have been opened, you would have been able to do everything. Everyone's working the same way. This is what would have happened in Alberta and British Columbia, Quebec, and provinces all across the country. We would have had a rapid spike in cases. We would have had a lot of people who would have died. We would have an overwhelmed healthcare system. But instead, what have you done as Canadians? Well, you've been the stationary dots. You've stayed at home. You've prevented yourself from getting sick, and you've prevented yourself from getting others sick. And because you've done that, we've really flattened this curve. It doesn't mean that we're going to not see bad outcomes happen, but we're going to see this happen at much less rates. And this does mean that these factors, these social distancing things that we're doing, are going to stretch out longer. But what that means is there are going to be much better outcomes for Canadians across the country.